Opportunities with this last panel. The moderator is Dr. Laurie Stradley, Executive Director of Impact Health. Pam Peak, Care Navigator for Impact Health. Reverend Dr. Blake Hart, thank you so much. And yes, Executive Director of Haywood Christian Ministry, and Dr. Sonya Jones, Executive Director of Caja Solidaria. Please come up stage.
Good afternoon, everyone. It's always a pleasure to get to spend time with so many of you, even if we got the after lunch slot. But I know we got the after lunch slot because we have some really exciting things to talk about this afternoon. We're going to dive in here in a minute to talk about the healthy opportunities work that is happening across the region and across the state. But as we do that, I would really ask you to think about this as an example of what powerful, integrated social clinical healthcare can look like. Right now, our population is Medicaid managed care members here in North Carolina. But we have built structures, systems, and most importantly, relationships that can help support people regardless of their payer model. So we're going to spend some time talking specifically about one very successful intervention. I wish I could share even more data than we have today, but it is coming soon. We're making progress. And as we get started, I'm going to ask some of the folks around the room to introduce themselves, because part of our network is here today. And we want to celebrate not just the folks who are going to be up here telling these stories, but to know that these stories are being replicated in organizations all across the region. Before I hand things over to our panelists, I'm going to talk through a little bit of what is happening here in Western North Carolina. I don't think any of the statistics on this page will be surprising to anybody in the room, but we've spent a lot of time talking about clinical care today and access to clinical health care. But we know that clinical health care sits on top of a pyramid of health and wellness that comes from other places. You hear the phrase social needs, you hear social drivers of health, social determinants of health, non-medical drivers of health. The lingo is everywhere right now, but what we're talking about is basic human need. Food, housing, transportation, safe families, and the opportunity to thrive in your places, as Tara said earlier, where you live, play, pray, work, and just exist. But we know that there's a great deal of need in our communities. Up to 5% of Western North Carolina households do not have access to a vehicle. We know that's problematic, especially in rural communities, because we don't have public transportation infrastructure. Almost 20% of our residents here are food insecure. It doesn't just mean that they don't have enough food every day, but they don't have the food that allows their bodies to thrive. To think back to what Dr. Hedgepeth said earlier today, that is at the cornerstone of our ability to tap into learning. Our young people need to have enough to eat so that they can be at school every day, be well, and learn. 42% of all Western North Carolina households are rent burdened. That means that for every $100 they bring home in pay, $30 have already gone back out the door to pay for just the roof over their heads. Not even talking about keeping the place warm or with fresh water flowing. And in 2021, state-funded domestic violence agencies received almost 18,000 calls from Western North Carolina residents seeking support to get into safe family situations. Enter the Healthy Opportunities Pilot. This is a part of broader Medicaid transformation in our state. The recognition that healthcare costs are out of control, and we need to find ways to bridge those to meet those needs before they become critical, before they prevent people from living their lives, from working their jobs, and from thriving. The Healthy Opportunity Pilots is a first-of-its-kind program that provides evidence-based non-medical interventions. That's a fancy way of saying we get people access to the food they need, the housing that protects them, the transportation that gets them access to more stable employment, to healthcare to grocery stores. And lastly, interpersonal violence and family safety, both on the prevention side, what does good parenting look like? And on the intervention side, let's help you get to safety so you can keep moving forward. Right now, Healthy Opportunities provides 28 different services across 4 domains of social need. Again, housing, food, transportation, family safety. And that is done in 3 regions of our state right now. Western North Carolina is the largest, both geographically and by population, as a part of this pilot study. And next week, we'll hit our 2-year anniversary. So in just 2 short years, this is what has happened in Western North Carolina. We have nearly 6,000 clients participating in Healthy Opportunities. There are 54 human service organizations, those are nonprofit and government agencies that were already established, already doing great work in our region, and are now doing more. 101,000 services have been provided to date. That's even an update from what I presented to my board 2 weeks ago. And that means 101,000 food boxes delivered, roofs repaired, moldy rugs mediated, HEPA filters put in to help a child breathe freely. Just in February alone, 11,000 services were provided. So you can see that this is ramping up. Folks are getting connected to what they need. Impact Health is providing training and technical assistance to support those agencies in rising to meet this need. So just in the last quarter of the year, 257 hours of support were provided by Impact Health staff to make sure that those network members have everything they need to meet this demand, to meet the compliance of being part of a state and federally funded approach to meeting the social health needs of our region. And this last number that you see here is $17.6 million in billable income. This isn't just an individual health conversation. This is a systematic approach to improving the health safety net of our region. And this is a new revenue stream that comes into our nonprofits, to our government agencies, to help them stay strong and get stronger. So that $17.6 million is in billable income. So a service has been provided, the agency bills for that service, and then is reimbursed with Medicaid dollars. And as I stop here to look at what has happened, the people who are doing this work are all across this room right now. If you're a member of one of Impact Health's, if you are a member of Impact Health's Western North Carolina network, if you are a human service organization providing this work, would you stand up just for a minute and be recognized? Thank you. I'd also like to take just a minute for the Impact Health staff that was able to join us today to stand up for a second. These are the folks that are partnering with these organizations, making sure that those bills come and the claims are processed properly. Would you stand up just for a second as well? These folks are usually behind the scenes, so they didn't know I was going to do that to them. And basically everyone else in this room, whether you know it already or not, are already a partner. From our legislators who support this through policy, practice, and funding, to our community partners that are spreading the word. You are all in this with us, and we appreciate you. I'm going to move through these last slides a little bit quickly so that we can get to the rich stories that our panelists have to share. When we started this work, it was a careful approach to invite people in. We know that there's great need in our region, but the Healthy Opportunities work is specifically for a subset of Medicaid managed care folks. We couldn't throw up a billboard, we couldn't scream it from the rooftops or the mountaintops, because we knew that we would find people who need this support but are not eligible for this specific program. So we worked carefully with those same folks you saw stand up to recognize that trusted messengers are the best way into this program. So we created the no wrong door approach that allows folks to come in traditional pathways like their medical providers, to come through the human service organizations that they already know and trust and are operating in communities, and through Impact Health. We have a single phone number that can help you connect, and you're going to hear more about that when Pam gets to share her work. And that is how we got from a few hundred members 2 years ago to nearly 6,000 today. And that number 6,000 is underrepresentative because this work impacts households. Whether it's a family or a group of folks that are living together and navigating the world, we know that that impact is much greater than those individual members. So how does this work? This is an example of a person that is going to work through the process to get support. So consider Tom, a Medicaid recipient, who goes to a clinic with prediabetes symptoms. The doctor that he meets with identifies that Tom doesn't only need medical support, he doesn't have access to healthy, nutritious food that's going to help him manage this metabolic disorder. So Sue refers him to a prepaid health plan. Those are our Medicaid managed care providers, care manager. That care manager then connects with Tom and tries to understand more fully the needs that he has to support preventing that prediabetes from turning into a diabetes diagnosis. She understands what he needs and works through the NC Cares 360 platform to connect him with the organizations in his community that can provide his care. Tom's blood sugar gets under control, his health improves, he doesn't have to see the doctor as often, he doesn't need a new prescription, and he's reduced his medical costs and is now feeling a lot better and getting food that he needs to get through his day. As Tom's doctor monitors his symptoms, Sue receives, that care manager we mentioned earlier, real-time updates and can track Tom's total journey, understanding where to plug back in and where to leave Tom and let him keep going with the good life that he wants to be living. One of the reasons we're going last today is because we're trying to bridge across multiple conversations that are happening. Two things that I want to talk about with workforce, and I'm going to ask our panelists to think about this too. One is that social health care is a healthcare workforce. So we have to think about our nonprofit staff and their expertise around the region as we consider the total health workforce. And that includes community health workers, and it includes people who wouldn't identify that way, but are doing that work and supporting them to get access to the resources they need. The second is that you've heard this come up a few times today, our medical providers are experiencing stress related to the fact that their patients need support that they can offer. So as we speak to more providers around the region, we hear them saying, if I knew that my person could get food access when they leave the room, and then when they come back around, that I can check in and know that they've had it, that relieves a huge amount of stress and secondary trauma for our healthcare providers, which we hope will increase resilience in the workforce and an interest in staying in the field, whether that's the person checking them in to their appointment and feeling worry and care for those people that they see, to the nurse, to the community health worker, to the physician who's making prescriptions. And I'm going to leave these with you thinking about not just the individual receiving care as a part of this systematic approach to supporting the people in our region, but the ripples go out from the families that are receiving direct support to the healthcare providers that are more successful and reducing healthcare costs and increasing positive health outcomes, to the economic impact of those folks who are contributing and supporting these health interventions. Our farmers are both members and part of the system that's providing support. So you see these families that are doing a great service to our region. They're creating the food that's feeding each and every one of us, regardless of the way that you're paying for it. And they're often sacrificing in order to do that, because our food system is a tough one too. We're gonna make sure you have access to these slides, I think, as well. But I'm gonna keep going because it's time for us to turn to our panelists. As we get started, I'm going to ask each of you, if you wouldn't mind, take a minute or two to reintroduce yourselves. It's been a few minutes since we first talked. If you could introduce yourself and share your connection to healthy opportunities and what brings you here today. And I'm going to start on the end. Blake, if you wouldn't mind going first.
So my name is Blake Hart. I am the Executive Director of Haywood Christian Ministry in Waynesville, North Carolina. And we are one of the HSOs, one of the human service organizations participating in both the food, helping with food assistance, food domain, and housing issues.
Thank you.
Hello, I'm Sonya Jones, and I'm the Executive Director of the Solidarity Food Box, or Caja Solidaria. We provide housing and food services, primarily food services, in Henderson and Transylvania County.
Hello, I'm Pamela Peak. I'm from Henderson County. I work as a care navigator with Impact Health, and I'm one of the forefronts. I'm helping these people get enrolled in HOP, determining if they might be eligible, and help them navigate through resources.
Thank you. I have a few questions to get us started, but I hope we'll have plenty of questions from the audience. And again, we have a great representation of our network here, so I hope you'll stand up and share some of your stories as we go as well. Pam, as a Healthy Opportunities Care Navigator, you get calls every day from Western North Carolina residents with critical health care related social needs. How does Healthy Opportunities in your work help members gain access to those needed support that will help them thrive as families or individuals?
Well, HOP offers a multitude of resources that allow individuals and families to gain access to vital necessities that they wouldn't have had access to otherwise. For example, the program provides healthy home goods and home accessibility or safety modifications, and these provide supplies starting from as small as housing cleaning supplies all the way up to washers and dryers. These are essential to maintaining an everyday, healthy home living environment. My role in helping these members navigate through the available resources and meeting these needs helps bridge the gap, helps them not have to worry about how they're going to eat, how they're going to support their family, how they're going to fix their leaking roof, but still be able to provide attention and activities for their children.
Thank you, Pam. Just as a follow-up, would you share a little bit about the kinds of barriers that members have shared with you that are being resolved by accessing these resources through Healthy Opportunities?
Well, first of all, I will say the first barrier that I hope to overcome is by sharing my personal experience and having been in the similar situations. I, having been a Medicaid recipient myself, was eligible for HOP services. So sharing with them that I receive Medicaid, I understand the judgments and the stigmatism, helps them feel comfortable to want to enroll and tell me their needs so that I can best suit the needs for their household and their families. Members have also shared with me the barrier of feeling unsafe in their homes due to needed repairs and feeling restricted to not being able to enjoy extra activities with their kids because there's a financial strain. Also, we've resolved the issue and barriers of helping people find affordable housing, helping them figure out how to look for housing, and then helping them with first month's rent and security deposit. So that also helps ease a financial burden to allow money for other things. We help them feel safe. We help them feel encouraged and help them feel independent because they're able to supply these things for their house like every other body or anybody else with any other type of insurance. Medicaid is an insurance just like anything else, and it shouldn't be treated any differently. And we use the terminology when we're helping them navigate that it's not just because you're a Medicaid recipient. This is an added bonus. It's a benefit to help you thrive as an individual and become better in your home, to be able to stay safe and healthy, to help your community just like we are trying to do.
I think if I could draw a thread through there too, as you talk about all of those different pieces, is that one of the goals of Healthy Opportunity is to simplify so that they have one person to talk through all of this with and try and help them connect to the right resource at the right time. Is that fair?
That is fair. First of all, the first call you get is people are thankful that somebody answered the phone. That they have an actual voice to talk to, and like somebody said earlier, that human interaction, like just like at DSS, being able to talk to somebody and have somebody hands-on, but knowing that you can call us back with any questions, even if we're not the person with the answer, we're going to find the answer, or if we can't help you, we're going to help you find other resources. So we are the forefront, and it is nice for them to have one person that they know they can call and connect with.
Thank you. Blake, I'm going to move down to you next. Haywood Christian Ministries has been supporting the needs of your community since 1970. Why did you decide to join Healthy Opportunities?
Sure. So when Haywood Christian Ministry was founded in 1970, the goal at that point was to find the gaps in care that existed and to fill those gaps. But as we learned over years and decades of assisting our neighbors, was that many of the services that we were able to provide were not helping those people to truly thrive in community. It was superficial aid at best. And so we sort of developed this commitment over time to think about our services as trying to build community where people can thrive, and providing the resources and the assistances that are needed to make that happen. And so when I started with the organization in 2021, we started going through some significant program evaluation around that commitment to make sure that people are thriving. And it was at the same time that Healthy Opportunities came about. And so at first we sort of looked at Healthy Opportunities as a way to enhance and expand our food work, which is one of the primary things that we focus on food insecurity. We know that with a donated food stream that people are subjected to the leftovers of society and produce that is about to go bad, canned goods that are expired. And so we saw Healthy Opportunities as a way for us to offer a consistent and healthy option for people who are food insecure. But as we sort of were looking at it, we realized that perhaps Healthy Opportunities could help us learn and explore other avenues of assistance. And so that's why we decided to join both in food and in housing, so that we could experience and explore and discern what are some other options that are out there in a way that wouldn't necessarily do damage to us, because there were resources to help us make that happen, and guidance from Impact Health to help us to know best practices and those sort of things. And so our goal was to expand our current programs, but also to gain that organizational insight as we grew and as we developed. So.
Thank you. I think I've heard all of the panelists feel like they're talking too much, so I'm going to ask you to keep going.
Okay.
Can you talk a little bit about how it's expanded your ability to serve community and what it's looked like to move into housing?
Yeah. So I'll say HOP has given us so many opportunities to increase our impact. It's helped us to network with other organizations, to help us to explore new partnerships with community members, with community businesses and such. So just in terms of impact on the people that we work with, we've gone from being able to just offer small financial assistance here or there to being able to, and my notes just went away on me, being able to provide housing case management to over 100 families. And so that case management is 3 to 6 months of support for that family or that individual, walking alongside them, helping them to find adequate housing, working with them to inspect the housing to make sure it's safe and healthy, helping them get security deposits and first month's rent, which is a lot more of a significant aid than just a small check to help you not be evicted this month from your rent. And so that's one thing. We started for the first time ever offering home repairs through Healthy Opportunities. Since the beginning, we've been able to offer home repairs. This includes current cases that we're working on right now to 75 individuals or families. And that's, for us, is less than a year of work in that domain, in that service area. And so in less than a year's time, we've been able to go from 0 to 75, which I think is pretty significant. Of those families that we've been helping with their housing navigation and stuff, we've been able to help 46 of them with security deposits and first month's rent to help them to get into the housing, to get established. And then for another 100 families, we've been able to buy either healthy home goods, so things that they need to live healthy, like air purifiers, HEPA vacuum cleaners, Breathe Easy kits, or also the furnishings for those apartments, a washing machine, a refrigerator, basic furniture, a bed so you can have some place to sleep at night. And that's all the housing that we were never doing before. We weren't doing any of that before. In terms of food, we've been able to add on to our current numbers, which is about 2,000 families a year, an additional 200 cases where we get to actually deliver food to people instead of just expecting them to be able to have the transportation or the time needs to travel across our counties to get to us. And those food deliveries are not just in our county, but we've also been able to expand to Transylvania and to Jackson and to Swain counties as well. And then we've also been able to provide produce prescriptions to individuals who need more healthy produce, as most of us probably do in our diets. And that we've served 250 different cases, individuals or families, providing over $100,000 worth of produce purchases. And so that's just to the people that we're serving, but for us as an organization, we've also tried to look at how we can use this to build the community around these issues. And so beyond those basic numbers of who we've been able to help, we've intentionally tried to funnel as many of the resources into small businesses, into local economy. And so, for instance, those fruit and vegetable prescriptions are accepted by small farm stands in and around Haywood County, or the Hispanic grocery stores that we have in Haywood County. And so one farm stand that's only open seasonally was able to receive $17,000 worth of purchases for fruits and vegetables. A year-round farm stand that we work with, again, this is only since I think May of last year, has received $50,000 of produce purchases. And the rest of that goes to the other scattering of farm stands or the Hispanic grocery stores. The 75 home repairs we've done so far have totaled about $270,000, and that's almost all gone to sole proprietors or individual contractors, not to large businesses, unless it's the mold remediation cases or pest removal cases where we want the expertise to come in and do that for certified standards. So almost all of that's gone to just individuals who are trying to build businesses or who are working on the side to try to support their families. And then this year alone, we've tried to move this focus of local purchasing into our work with the purchasing of healthy home goods and furnishings. And so in 2 months' time, one small retailer in Haywood County has received $15,000 worth of furniture purchases from us and helping set up people's houses. And so we're really trying hard to see how we can take this huge resource and impact the people that are receiving the care, but also the community as a whole. And then on terms for us, we've been able to hire 3 new staff members whose sole focus is on caring on for the community. So we were able to hire MSW for the first time on our staff to be able to lead this program, a community health worker, and then another case manager to work full-time on caring for our neighbors. And that's all thanks to the Healthy Opportunities program.
When I hear these stories, I always feel just incredibly lucky to get to be in this work with you and with the others doing this work. It is just an incredible thing to be a part of. And I really want to highlight 2 things that you just said is earlier in what you were saying, is that you walk beside the folks who are doing this. This is not walking down. This is folks who are trying to do the best they can to get on the right direction for thriving. And we just have these incredible members who are doing good things and want to take good care of their families, and the dignity and support and respect that comes from this network of human service organizations is unparalleled, and we appreciate you. The other piece that I wanted to highlight too, because this is a taxpayer-funded approach, it is critical that we are intentional and excellent stewards of this funding. And I think it's important to point out that these dollars stay here. They are reinvested in our communities for folks who are also paying taxes and contributing to the economic diversity of our region. And so I just wanted to lift those 2 pieces out with gratitude. So thank you, Blake. Sonya, I'm going to turn to you now. You helped create a mutual aid network during the pandemic, which was, the idea that a crisis builds innovation, but you haven't stopped there. Can you talk a little bit about how your vision to help families access culturally appropriate, healthy, and mostly local food opened the door for you to make the leap and start participating in Healthy Opportunities? Can you talk a little bit about that for us?
Sure, I'd be happy to. So there was a group of us who were really committed to being in solidarity with farm workers, with service workers, especially early in the pandemic. And so figuring out how we support our local farms, farm workers and service workers in ways that use food as a connector, because that's what I always like to do. Everybody likes to sit around the family dinner table, right? So building on the beauty of food as a family connector, as a community connector, we brought people together to buy local food at wholesale cost from local food businesses and local farms. We use that as a fundraising mechanism to support local food banking. And we just kept doing it because we enjoyed the community connection it was making and how it was supporting our local farms. So Dion came to our community via Zoom because it was the pandemic, right? And came to a community coalition meeting, and she said there's this amazing opportunity to pilot an idea where health insurance is going to ensure healthy food access. And I thought, the group of people that were doing this with me thought, this is an incredible opportunity for us to continue building a healthy local food system by taking a federal investment and investing it in our local farm workers, our local service workers, and our local farms to bring all of those pieces together to support local health and build a strong community foundation. Do you want to?
Yes.
Thank you. So let me tell you a little bit about how that's gone so far. So we got a little bit of capacity building funding right away to help us become a nonprofit, which was amazing. So last February, we became 2 Februarys ago, we became a nonprofit. In April, we started delivering services, and we just hit this milestone this week. We've delivered 10,000 services through Caja since we started. Thank you. So what does a service look like at Caja these days? What that looks like is we have 12 mobile markets that do routes, and we have pickup markets where people can come and choose fresh fruits, vegetables, local meats, and whole grains. It's a nutritionally designed, evidence-based strategy where people choose foods that make sense for their family. They get nutrition education support, food nutrition case management. We also provide wraparound services for non-toxic cleaning supplies and other healthy home goods you've heard a little bit about, and utility assistance. We're moving into housing navigation services as we grow and we hear what people need. So this is a really incredible opportunity for us to invest in our local community. So those 10,000 people represent about $1.5 million of federal tax dollars that we've been able to recapture and get invested in Henderson and Transylvania County, primarily through paying for living wage jobs and supporting our local farms. So I want to talk just a minute about those living wage jobs at Caja. We went from no employees to 12, and people stay with us because of, I think, a very innovative organizational structure that we have. We have an equity pay scale. We all get paid the same amount. We choose that amount based on the living wage for families with children. So that means that we're attracting an experienced workforce that lives in our community and wants to stay there and is committed to doing the work together. We have a democratic workplace, so everybody has an equal say. People are very self-directed in the work because of the workplace structure that we have, and I'm happy to talk more about the details of what that looks like. And within all of that, that really builds what I think of as an owner's mindset. So all of us feel like this is our organization and we're leading the way forward. And we do all of that in a trauma-responsive way. So outside of those amazing jobs that people really want to have, right, we've invested about $1 million in our local food and farms in the past 2 years. And that's in a time when the food system is really struggling. Like, there's a lot of instability after the pandemic in the food system. So I asked one of the primary food vendors that we work with, especially in the wintertime, how that's impacting him, and I shared this quote up here of like, this has really made a difference in him being able to be stable. And a lot of the farms that we buy directly from have actually been able to expand their operations because we've been able to support and work with them on planning and crop management. So it's super exciting. We also work to really have zero food waste in all of our operations by composting, by working with families on how to use the food, and because everybody gets to choose which foods they're taking home. All of this is possible because we get this incredible investment through Impact Health and state and federal matching dollars for capacity building funding. So I did a little bit of math, and as of last week, every dollar in capacity building funding that we've gotten at Caja Solidaria has led to almost $4 in HOP reimbursements since the time we started. So that's $4 for every dollar invested that we bring back to our community to invest in these living wage jobs and our local farmers. And most importantly, thank you. And most importantly, in really building this strong foundation for community health and supporting human potential in our community.
Thank you, Sonya. I never have words after you speak. You just have such a beautiful way of tying it all together. And I think what you're talking about, what you're representing here is that it is all interwoven. And in order to have thriving communities, we draw these threads together. We talk about having 4 domains, but food and housing and transportation and safe family environments are all woven together. And many of our institutions are crossing those boundaries and working with experts in the community, like our community health workforce, that can't be focused on one domain because they are focused on the people that are navigating the systems that we are trying to change. I think we have covered most of our individual questions, so I'm going to ask you one more before we open things up for this audience. But could you talk a little bit, each of you, about either what has been the most rewarding aspect of your engagement with Healthy Opportunities, and or what can you see on the horizon that would make this even more successful? Anybody want to go first, or shall I? Popcorn. Pam, do you want to go ahead?
I'll start.
Thank you.
What's most rewarding for me is seeing it come full circle. So you asked initially, how did we come in contact or learn about HOP? So first, one of our HSOs, Children and Family Resource Center, asked me to join their team as a billing specialist because they were joining the HOP program and providing formula to babies through prepared meals through HOP. So I took on that role, but before I could start, I was hospitalized due to a major surgery. That Medicaid covered, Medicaid paid for. Thanks to that, I am now down 90 pounds, healthier. And while in the hospital, I received a call from Mission Health Partners, who I'd never heard of. That was the no wrong door approach for me. And let me know that due to my circumstances, I might be eligible for HOP. And I was, and I connected with Sonya and received wonderful, amazing, healthy food to help me through that transition of not being employed. She also took the time to ask me my needs. I wasn't able to eat any solid food, so she brought me a blender to make wonderful smoothies. And then I was stalking the Impact Health website, I can't lie. I was like, I want to be more involved. I don't want to just be the billing specialist over here. And a job opportunity, actually as a billing specialist, came up, and as a care navigator, so I was kind of deviating between the two, but the care navigator really came to heart for me, and I did receive that opportunity to now be directly involved, impacting lives. I am a direct result, a direct impact of Medicaid, a direct impact of Impact Health, a direct impact of HOP.
I can't say anything to add. We are beyond lucky. If I had known that Pam was stalking us, then we would have gotten there sooner. The dignity and grace that Pam offers to communities that have often been harmed by programs like this creates a safe place for people to accept the help that they are eligible for. I think that's sometimes really difficult in our region with our history of rugged individualism, that asking for help is a weakness. But we know that when we're building community, you lean in and you lean out. And Pam is a perfect example of that, her willingness to accept help, has now given help to thousands of families across our region who are also getting a hand up, not a handout. And I appreciate you sharing your story because it brings many more people. If you didn't know Pam before today, I will be surprised because
You're going to know me.
yeah. It's one of the reasons that you see our numbers tick up is because of the trust and the community organizing and building that Pam has done around Western North Carolina.
Thank you.
I know she's tough to follow, but one of you can take the best.
I'm looking this way.
Want me to go? I think for me, it's similar to what I already said. It's being able to bring resources to the whole community, to individuals who didn't have it before. Through intentional hiring and intentional outreach to certain communities that we didn't have access to. We've been able to reach our Hispanic neighbors that we didn't have much access to before. We've been able to reach pediatric members of the society. So most of our cases for a long time have been pediatric cases, whereas our previous model mostly served the elderly, which both need help, but we were able to expand and bring resources to bear. But then also to be able to look at the whole person, to be able to look at someone walks through our door with a fruit and vegetable prescription, and we can connect them to car repairs, we can connect them to housing navigation, we can connect them to safety initiatives, to legal help, legal assistance. That's just an amazing thing that it's all there in that one program, and that it's done in a way that we as nonprofits don't have to worry too much about our bottom line, what's it costing us, where's the money coming from, how many donations do we need, who's the support. It's just built into it, and so that's wonderful.
Thank you. I think that's a great example when we think about the network and this being an asset-based approach. I meant to mention earlier, I did say this is the first of its kind, but the rest of the country is looking at us, and they want to know how this works and how they can replicate it. Just in the last week, I've spoken with leaders from New York State and from Pennsylvania who are hoping to do what we've been able to accomplish here. And part of that is the relationships. And so we aren't just a group of individual providers. The network, the Western North Carolina Healthy Opportunities Network, is building a relationship between. So Blake can feel good calling Madeline to say, I've got somebody who needs legal support. They still get that individual still gets that support through their care management, but there's no hesitation between all of these institutions because they know why we're doing this and how we're doing it, and that the folks that they have relationship with will be supported in other places.
Thanks. So I thought a little bit about this as what success would look like for us in the long term. And I read the state goals of this project as overall reducing healthcare costs and improving healthcare outcomes. And obviously, those are things that I would love to see happen for all of us as well. And I think those are long-term goals. And I don't have the data to know how we're doing on that. I would really love.
So would we. It's coming, I'm told.
I would love to know. My board says, we need to be on mission and this needs to be financially sustainable. So those are questions we need to ask with earnestness and looking forward as we think about next versions of these programs, ask if it is financially viable for us to offer these programs in the ways in which we're doing it right now. The people that we think of as members really want to have their dignity affirmed in all of our work and to be connected to people who care about them. And like I said, food is a really beautiful way to open a door to that kind of relationship. My team really wants us to be effective. Like they want to come to work and feel like what they're doing is great work. And I mostly think of the hundreds of moments I get to have every day. Pam mentioned the blender, that's one of those moments. But Tuesday, I was teaching nutrition education. This little guy kept coming up to the table and taking the cups of little grain bowl samplers that I had. He's 4, he's eating them, and his mom's chatting with me. And then she's like, I can't do brown rice. And I'm like, well, he's eating brown rice right now. And she was like, what? And was really pleased and surprised to learn that this food that she thought was kind of unpalatable and a little bit scary to cook was actually something that he really enjoyed. And it's those hundreds of moments, those hundreds of opportunities that we have to build community and create joy around food. are what success looks like to me.
Thank you. We have asked a lot of questions that we prepared and wanted to talk with you, but now we'd love to hear from you. And as I mentioned, I see all of you out there, the leaders of this work as well. We are grateful for these three for representing you, but we would love to hear from you too if you have stories or questions. I think we usually start with the elected officials, if anyone wants to go, and then we'll rotate around. Do you have any takers? Hi, Julie.
Thank you. So amazing. It's like astonishing that it's taken us this long to actually get to something like this. But we're here, and that's great. Two questions for you. Number one, what can we as legislators in this region do to support the program as it, I think you've applied for reauthorization, or I don't know the right words, but how can we support you? That's one question. Second question is, as we interact with our constituents, who we perhaps perceive might be eligible for this program, what do we do? Who do we send them to? And can you just say, in answering that, a little bit about the eligibility? Because it's obviously not everybody on Medicaid, so what are the criteria there?
Thank you, Senator Mayfield. I'm going to let Pam, if you'll take the first question, I can speak to the second question. I'll go back to the logistics of the first afterwards, but please go, Pam.
First of all, in order for us to submit an application to the prepaid health plans, which are Healthy Blue, WellCare, United Healthcare, AmeriHealth, or missing, did I say all of them? I hit them all. Okay. So that somebody in the household has to receive one of those types of Medicaid. It doesn't have to be the parent. You know, lots of the Hispanic families, the parents aren't eligible for Medicaid, but as long as at least one of the children have it, the whole family is going to be eligible. And then second, which is left up to the PHPs to determine, they do have to have at least 2 social determinants, which are physical or mental. So they could have asthma or have been hospitalized. It's different for different age brackets, but that is completely left up to the prepaid health plan. And some of them are a lot more lenient than others. And then we just, they can call to enroll, or they can go out to our website to enroll. The applications still come to me and my colleague, Brandy. And then we submit them to the PHP, and they, we hope that they accept them.
Yeah, all of you have a flyer in your folders. We did create, Jennifer Caldwell here is our communications lead for Impact Health to try and get more people connected. So you'll see a flyer in there that helps you see by district where there are operations. We have full coverage of all 18 counties in Western North Carolina that you can access resources, but there is a phone number. That is the number that will get you to Pam and Brandy, and there is a website. You can give that phone number out. You can hand that and say call, and Pam and Brandy will work through that process. And so just to reiterate, the eligibility is that currently you have to be a member of standard plan managed care. Soon to come, this summer, the tailored plans will go live, and those members with tailored plans, and those are folks who have complex mental health needs, substance use disorder history, intellectual developmental disability, those folks will become eligible for Healthy Opportunities this summer. And then we also have a few more Medicaid direct folks that will come on over the coming months. For example, some of our dual eligibles will start to be able to access resources. And I'm going to bridge that over to what's coming. For the last 5 years, as this Medicaid transformation waiver has come into play, we have been trying to expand eligibility because we know we started with the folks who may need the greatest degree of support and have the most serious chronic conditions. And now we think we can expand to support people with a greater degree of preventive health care, making sure that young person never acquires asthma because of the environmental triggers in their household. So we'll start to expand that, and with the next waiver, we are under application right now. That waiver went in October of 2019, and it typically does take a year of negotiation to make sure that what we're trying to do in this state aligns with the vision in the HHS federal administration. And so those negotiations are ongoing right now. It seems very positive that it is more a how, not an if conversation, that we will move smoothly into the next 5 years of this waiver. So to answer your question on what can you do, one is that there is always a state match to this program. It is an innovation, and it requires us as North Carolinians to invest alongside the federal dollars. So that ask will come from HHS as they build out their investment strategy in this part of the program. Two is that you can talk about how this is working here and help people understand the connection between investing in these pieces and reducing overall health burden in the state, which opens up a lot of doors. If you talk to any economic development person working in community, they know that a healthy workforce is well supported and brings business into our state and into our communities. So being able to talk about those different ways that this impacts. And then lastly is to offer your support as you have federal colleagues that are understanding what is happening in a healthcare transformation, so that this waiver comes smoothly back to our state to keep doing this important work, which in fact will expand. So I see our senator from the central part of the state. We want this work to cover every county in the state so that every individual can have that opportunity to thrive. And that, again, will require state investment alongside the federal support and investment from the waiver. Anything you all would like to add? Because these folks are supporting you not just in the macro level, but in everyday work that you're doing. And I would love to have any additions if you would have them.
I'll say that, like she said, the best way to help is to talk about it. Seeing a face, a familiar face, hearing a similar story is what helps people be willing to enroll, being vulnerable, but talking about it. New York has mimicked us. Little North Carolina, Georgia has mimicked us. We have paved the way. I'm so proud of North Carolina and what we are doing.
I think I want to just lift up what Honey said, that all you're hearing right now is community health work, right? We're not certified, but this is community health work, so, yeah.
Thank you, Sonya. Yes. I see two. I saw Lizzie and Evan. Yeah, thanks.
I just want to tell a story as a nurse midwife who works at Navigator, that I've had the experience of benign and partnering with high-risk women, women who had two babies at 28 weeks and 30 weeks, and know how fractured our system is, that they need somebody that they can count on to reach out to. So I'm often giving my cell phone, different cell phone to these people, and ask them, you can text me any time, day or night. And one of the people recently that I supported, who was in a violent, abusive relationship, ended up homeless with her son, still working in her job, trying to make ends meet. And I had this card from Impact Health with a QR code that I was able to sit down with her, give it to her, we sat together while she filled it out. She was contacted, got connected to HelpMate, got housing, her car got repaired, and she ended up having a baby at 32 weeks and had a home that she could go back to. It was one of the most stressful experiences for any family to give birth to a baby who ends up in the NICU. You get discharged 2 days later, and you're having to go and see your baby every day. And she had a home to go home to, and had a car that enabled her to be able to drive to the hospital. And she recently texted me, gave me a picture of her family, the baby, at home. And this is an Impact Health success story, so I just wanted to share that.
Thank you, Evan. That's exactly what I meant by everybody in this room is a part of this network. Thank you.
So, Evan, you made me cry. I know I have to go. This is just a question. So obviously we are one of 3 in the state. Can you just reflect on how Impact Health is going but how are the other 2 doing?
Well, I mean, I will say that we sink or swim together. So we work very closely with the other network leads because this is an incredible opportunity and we will not fail. So we work together closely with Access East is based in the Northeast. I can find that map. Don't look, you'll get car sick. Give me a second. So that's Access East in the Northeast and Community Care of Lower Cape Fear in the Southeast region. And while ours is the largest by geography and by numbers, we are all doing very aligned work. And I will say that our network is very well connected to one another. And I think that speaks to the assets of this region that were already in place, is that we know and we give trust by default. So I'll trust you now until you tell me not to. That is our culture out here between these agencies. And I think we're very much in a region that has some unity, some cultural connectivity that is unique to Western North Carolina. But we face a lot of the same issues, so we're able to solve problems together. So for example, one of the things that our community organizations struggle with the most is paying upfront for cost of doing business and then receiving that payment 30, 60, maybe longer if they have any hiccups along the way in billing. And so Community Care of Lower Cape Fear has innovated around revolving loan practices to support HSOs. So we are trying to build that same kind of support out here. We just launched an investment or a funding strategy for our community health workforce. It's open right now. I can't remember what day it closes, but soon. April 12th, thank you. So that funding strategy is open, and what we're trying to do with that funding is to put dollars into the hands of community health workers so that Healthy Opportunities will be one of the tools that they have in their toolkit. So it's very lightly restricted. We're only asking that our community agencies that receive the funding become experts in healthy opportunities and enrollments so that they can get more people access to these resources. And so I've had discussions with the other two regions about how they may work similarly. Community health workers are fully present and have been from day one. This is just an additional amount of funding to help keep furthering that work. So I can't take the bait too far, but I will say I personally, from this work, get calls from all over the country right now. We were also invited to join a national learning collaborative around community health hubs with an eye on Medicare, and how can we take this model that is working right now and pivot it towards our older adults that need the same resources.
Thank you, Emma, for ceding over to the green. Hello. Good afternoon. My name is Joanna Grimagichan. I'm the Executive Director for the Asheville Buncombe Institute of Parity Achievement, which celebrates its 20th year this year. That's important is because we were founded on the basis and the thought of community health workers, which is then called Parity Action Team members, and social drivers or social determinants of health. And now, because of this initiative, we are being funded in a different way to do the work we've always done. And so I'd like to say yes for that. The other part that I'd like to say is, Dr. Huston said something that was very important. Can we go back to the slide with all of the numbers?
Which one? This one?
I say that is because a lot of times we have to, data brings numbers, but each one of those numbers reflects a PAM. Each one of those numbers reflects the story that Emmett spoke of. And I want our state legislature to always remember that too, because when we're making policy, whether it's big or small in our practices, just know that the impact and the dollar impact is a life impact.
Right.
And for that, I am very excited of us continuing this work, because I have those little stories too, because as an ED, I'm a working ED.
Yes, you are.
I drive sometimes for our impact deliveries. And I love that one of our little guys runs out and says, "Thank you, good people." And will send us emojis because my staff, when we deliver, we say, "We're here," we dropped off, and then he sent us a little emoji of a bear with the heart going across it from his mom. And so again, those little things make a big, big difference. When we see that because we innovated and had a link for people to choose what they want, that they can choose water or they can choose juice. And 90% of people are choosing water. That's a good thing, right, from a healthy choice. But then also, what is it that is causing them to ask for that water? Is it because they have wells that also need filters? So there are all those different things that we really need to be cognizant about, but really proud of as we continue this work. And so I thank you for all the ears, all the beats, and all the dollars that we continue to come the way to really make this an impact beyond anything we could ever think. Because again, this is a vision of people that are now gone, but we're living it and we're propelling it forward. So thank you all.
Hello everyone, I'm Emma Olson. I serve as the interim executive director with the North Carolina Center for Health and Wellness here at UNCA, and I'm so grateful to y'all for all of the work that you're doing, and I'm very grateful to y'all for coming today. So thank you. Wanted to touch on something you said earlier, Laurie. I loved the way that you framed support people and give them the help that they're eligible for. And you also alluded to like an individualism, which I think is a key facet of Appalachian culture and something that many people are very proud of. Something that I've heard from folks in my own community is the worry that they would be taking a spot from someone else in accessing the resources that they might be eligible for. So my question, Pam, is this something that you are seeing and that other panelists are seeing? Is that a valid concern? And how do you respond? And I can just touch on Senator Mangold's question. You know, what can you do to overcome that and continue to grow in the ways that Laurie says you're working towards?
Thank you, Emma. And if you haven't worked with Emma before as the interim at the NC Center for Health and Wellness, she is leading evaluation of quite a lot of the work that is happening in our region. If you saw the video clip earlier about the community health workforce. Thank you, Emma.
I will say, so we do get those calls from people who feel like they're taking away food from somebody else that might need it more. But in my role and in Brandy's role, we're very trained and very professional in reassuring them that they can rest assured that everybody's going to get what they need. Everybody that is eligible is going to get the food they need. So don't feel like they're wasting it or that somebody else could use it more. And even in these situations when they do feel like that, or sometimes they get some that they feel like they can't use, they are re-giving it. So it's not going to waste. It's working. The process is doing what it should do. So our jobs and what we do is to reassure them that nothing is of waste and that because you are eligible, it is yours, and take advantage of these resources.
I would just add to that as we grow capacity, and we do need ongoing capacity building investments because of the way the program is structured, because all of the HSOs experience moments where we do have to close services. So there is a limited number of spots.
If I could add, though, I think one thing that we've talked about a lot at Haywood Christian Ministry is the fact that unlike other federal or state funding sources that are extremely limited in terms of a program that comes in and can maybe help 5 individuals with their housing because we're a rural county and not much money comes to us, the fact that this is based on Medicaid membership, there are times that we do have to close services, but it also feels somewhat infinitely scalable because all it takes is another hire and the reimbursements are there for it as long as people are eligible. So I think that's a wonderful part of this too, is that while there's a need for capacity growth and building, unlike other funding sources, if you qualify, it is your right to get it. It's there.
Thank you. And I'm going to add one more layer to it as well. The 1115 waiver is also known as a demonstration waiver. So we are being expected to tell a story. And the more people who join this and access the resources, we can better understand where the efficiencies are, where the best investments for the best health impacts are, so that we can continually refine the program. So if you have someone who can get in that academic headspace, we need you to enroll so that we can help figure out how this works best. And we're going to be 2 years ahead when our data comes out there. From what I understand, if our evaluation partners for this are the Shep Center at Chapel Hill is doing all of the quantitative analytics of claims data, which includes clinical claims and social health claims, to really try and understand the story of what's happening as someone comes into the program, receives care, and then how does that differ from folks who experience same clinical needs but did not enter into the social health support systems, and are we seeing efficiencies? And so the process, the way this works, is that SHEPS has to submit everything to CMS for review first, and then we'll get to see it. And so my understanding is right now the interim report is sitting with CMS, and we should have access to it soon. And we'll be able to share what we learned there with other states who are trying to mimic the work that we're doing. I think of it as leapfrog learning. They're going to learn from us, we're going to learn from them, and we need participants in order to better understand how this works. I think we have time for one more question. Who's Madeline right there in the middle?
Thank you to the panelists and to everybody here listening and learning. I'm with Legal Aid of North Carolina, but I'm speaking as an HSO, a human service organization, who's just been honored to be a part of this. I want to go back to something that Reverend Hart said, which is sort of building community. Part of what's happening, part of what's really transformative, and I credit Impact Health with this, is that we're actually creating community among the organizations that are working with people with really complex needs. And this social safety net, the social care net, the community health net work, most of the people we serve need the services of all these other organizations too. And now we know each other. That list of 54 that's in the packet, you know, I get a call from Sulin, or we get a call from another organization. We call others because maybe they do stuff that's outside of HUB, or maybe we just want to make sure we know each other better. But you're convening us, and you're creating a sense of community across 18 counties that I don't think has ever existed before. So I want to thank you.
I think that brings our panel to a close, unless any of my panelists have a final word that you want to share. Everybody feeling good? Well, then I'll take my last minute of privilege to say thank you to a few folks. First and foremost, Deon Greenlee-Jones, who served as our MC today. The moments you've seen up here are just the tip of the iceberg with the planning and support that went into doing this work today, and we appreciate you very much. We also have an incredible team that I think Deon is going to acknowledge as well, but since I have 2 minutes, I'm going to steal the privilege, and you can say it again in a minute. But the HPI, the Health Policy Initiative, has some incredible staff as well who have event planning is my nightmare, all the logistics, and these folks have done it with grace and complexity. So Sonny, Cole, are you around? And Vanessa, and Emma, and did I see Tim in the back? Thank you for your support. And I did say Vanessa, but there was cheering going on. Vanessa's right there, she's our fellow. And we also have support staff here helping make sure, I shouldn't say this, we're not done yet, haven't heard a single mic squeal today. So we're very appreciative. And of course, you have seen staff coming in, keeping us hydrated and well fed all day. So I really appreciate all of that. But I'm gonna turn things back over to our MC extraordinaire, and thank you for your time.
If you'll notice on the agenda, it says that I have closing comments. Sometimes we have to turn things around a little bit. So I wanted to do exactly what Laurie did, but do it again. we're extremely grateful for HPI staff, volunteers, fellows, everyone that's come together in this planning process to make this, I think, an amazing second year of this, and we're going to go for a third. So again, want to give them another round of applause. If everything I hear is what I keep hearing, the food was great. Thank you for hosting. Thanks to the staff who've been doing this behind the scenes and making everybody feel really welcome. Again, very grateful. My closing comments are, I hope that you found this engaging. I hope that you've heard some challenges. What are next steps for me? Help us promote the transformation. Help us promote the services. All of you all should have materials on your tables. Take a look at them and become well-versed in HOP, in Medicaid transformation. How can you support us in the state in doing this work? Also, if you would, there's an HPI flyer also on your tables to become more familiar with HPI. That's great. We would love to have you fill out the survey using the QR code, and that way you could very well add your email address if you want to know about future events and engagement opportunities. There's a lot we all can contribute to in this process. So again, thank you so much for coming, but we also want to invite you to another opportunity for fellowship at a reception in a little bit, so don't go anywhere. Take this time to say hello again to people and enjoy the rest of the day. It is Friday. This is a great way of ending the week. And again, we so appreciate your participation. Thank you so much.